All right. Thank you very much. Okay. So it's exactly 8 o'clock. Um, I think we should go right ahead, right? Because the night is fast approaching. It's past 8, and we don't want to keep people longer than we plan to. So good evening, distinguished policymakers, senior colleagues in the government, partners in health security, researchers, students, caregivers, and everyone present. Thank you so much for coming. Welcome to our March Cheap Talk Africa edition. For today's theme, Rabies on the Frontline, Field Realities, Challenges, and Lessons from Recent Outbreaks. The Cheap Talk Africa is a monthly dialogue which we began last year, middle of last year. And we've been discussing very pressing issues that matter to humanity and to our animals. Cheap. People ask, what is cheap? Cheap, CHEAP, means Community Health Enhancement Aid Project. And our mission is to promote One Health, empower local actors, and tackle zoonoses, poverty, and climate threats. It is an initiative of the War Against Rabies Foundation, a charitable organization which I founded and registered since 2017. So on Cheap Talk Africa, we have had very engaging conversations that have been with very notable individuals that are not very knowledgeable and influential, active and relevant scientists, policymakers. We've had so many from different parts of Africa. So far, we have had experts from Namibia, Tanzania, Ghana, Sierra Leone, and Nigeria. Our audience, therefore, is global. The program is young, but it's growing. And we are honored today to have with us Frontline veterinarians, a rabies researcher, and a representative of the Federal Ministry of Health from the Nigerian Neglected Tropical Disease Division joining us. Please, my beloved participants, remember to use your the chat box and drop questions and comments. Let our comments be very constructive. And so with that, we will be starting with our veterinarians. So the section 1 is field veterinarians giving us some talks, all right? So we will be starting with Dr. Okokido, Dr. Godswill. Sorry, I'm calling it the name differently. And we'll listen to his bio.
Godswill Benjamin Ukwe-Poko was born on 23rd March 1972 to Mr. Benjamin David Ukwe-Poko and Mrs. Patience in Agut Obolo, Andoni local government area of Rivers State. He attended State School Agut Obolo and Community Secondary School Agut Obolo, respectively, for his primary and secondary education. He proceeded to the University of Science and Technology, Port Harcourt, briefly between 1990 to 92, to study agronomy before gaining admission into University of Ibadan in 1992 and graduated with Doctor of Veterinary Medicine degree in 1998. After the compulsory National Youth Service Program in 1999/2000 in Taraba State, he worked with some private veterinary practitioners before establishing Oaks Vet Care Consult and practiced from 2002 to 2007 when he joined the River State Civil Service as a veterinary officer. He, however, gained admission to the University of Port Harcourt to obtain the Master of Science degree in Public Health Parasitology in the Department of Animal and Environmental Biology. At the moment, Dr. Godswill Ukwe-Poko is a Chief Veterinary Officer and the Head of Livestock/Veterinary Services Department of the Ministry of Agriculture. He is a Christian and is married, blessed with children.
All right, Dr. Godswill Benjamin, please, the floor is yours. Thank you very much, sir. You just have 5 to 7 minutes to tell us about the outbreaks in your state, etc. Thank you, sir, for coming.
Thank you very much for the opportunity. I must say I am privileged. It's been a desire to share this experience with colleagues globally. Well, in Port Harcourt in Rivers State, Nigeria, we've actually had a couple of challenges with rabies. In 2019, as a matter of fact, about 3 samples were sent to the National Veterinary Research Institute, VOM, JOS, out of which 1 tested positive for rabies. And then the victim was immediately advised to take post-exposure prophylaxis. And we thank God till today, the victim is still alive. However, in 2026, we have an outbreak, and it was with a clinician who was attending to an 8-month-old dog. A vet, he was bitten by the dog. The dog is an Eskimo. Actually, the mother, the bitch, had died the previous week, and then the puppy was presented at the veterinary clinic for treatment. And then while the clinician was attending to the dog, he tried to put the mouth guard properly, and the dog just snapped and bit him. Hello? Yeah, so, and the dog just snapped and beat him. So under the circumstance, he called me, and then when we shared the experience, we felt the best thing was to commence post-exposure prophylaxis immediately. Now, the dog died the next day. And then as the dog died, I recommended that the dog be decapitated and then the sample sent to NVRI for confirmation immediately, which was done. And then it tested positive for rabies. So that was the first case we had. And then at the same time, we actually had a case, an incident at the University of Port Harcourt Teaching Hospital, where an adult was on admission, and then the history revealed that he also was bitten by a dog. He had been taken to a private health facility before reporting to the University of Port Harcourt Teaching Hospital. He was admitted on the 19th of February and died on the 24th of February. At about the same time, we also received another report precisely on the 13th of February. And then a dog, which was, a pet dog with a family, and then all of a sudden just started being aggressive, was biting things, was biting objects, and then was also biting members of the family. As a matter of fact, 3 members of the family were beaten. Took the dog into confinement, and then That same day, the dog died. We had to advise the victims to immediately proceed to the University of Port Harcourt Teaching Hospital, their accident and emergency unit for post-exposure prophylaxis. Then the sample was also sent to National Veterinary Research Institute, VOMJOS, and it also tested positive. So that's the situation we have, and that's the outbreak at the moment in Rivers State, Nigeria.
Thank you very much, Dr. Godswill, for...
Hello?
Thank you very much, Doctor. Can you hear me?
I can hear you. I can hear you.
Okay, thank you very much for that brief on the outbreaks in Rivers State.
Yes.
With us is also Dr. Bolaji. Please, may I know if Dr. Bolaji has joined us, also from Rivers State? Dr. Bolaji, are you with us?
Yeah.
Okay, you're with us. Okay. So with us also is Dr. Bolaji. Remember to drop your questions on the chat as we go along, so that they will respond to your questions. Okay. Before we hear from Dr. Bolaji, I just want to play his bio. You just give me a minute. Thank you. Dr. Sarah, you are taking note of the questions, right?
Ajay, CEO MEX Veterinary Clinic Services. And
excuse me, please, are you seeing my screen? Are you seeing Dr. Balaji's picture? And did you hear his voice and the bio? I just started. Okay,
yes,
so I'll just take it back again and start all over.
Yes.
Thank you so much. So I'll start again. Thank you.
Dr. Bolaji Ajay, CEO MEX Veterinary Clinic Services, and NVMA Chairman, Rivers State. 1998 graduate of the University of Ibadan. Small animal and poultry private practitioner in Port Harcourt. Fellow CVSN, Clinical Pathology. Current Chairman NVMA, Rivers State Chapter.
So Dr. Bolaji, thank you so much for joining us tonight for this wonderful discussion. So let's hear from your own end more information on the Rivers State rabies outbreaks, if you're ready, sir. Thank you very much, sir.
Yeah, thank you, Prof. Thank you for the opportunity having me on Chief Talk Africa. Quickly, I'll just go straight to a brief overview of our recent outbreak. So, in February, between February and March, we've had 3 suspected cases. 2 of them confirmed positive. The other was thankfully a false alarm. So one of those cases was presented in clinic, and then the second case was a field case. Our note was brought to the behavior of a dog in a certain household, and then we took actions to contain the problem as it is, and then of course advised. So the first case was a male Eskimo puppy, intact, about 8 months of age. It was presented for complaints of inappetence and then reported change in behavior. And when we examined this dog in question, puppy in question, we found out that he had ticks, mucous membranes were pale, and of course he had a fever about 40.3 degrees. But interestingly, the dog appeared drunken. It was just acting funny, appeared drunken, and had this thing where he played dead. He would just lie down, all forms of life ceases. It's breathing, but it just as if you paused the video, and that's how the dog was acting. Of course, the differential for that case was tick fever. That was the first thing that would come to mind, because he didn't show any classical form of rabies. But now, in the process of examination, of course, we've been told by the TVS the clinician was beaten, that prompted further investigation. So even after they had left, we had to go back and do some research into the dumb form of rabies. And we discovered that the fact that the dog was playing dead and appeared drunken, maybe you point out to the fact that the dog may have had rabies, a dumb form of rabies. So we had to get in touch with the owner, and of course, we gave him an appointment for the next day. So the plan was that when the dog comes in the next day, the dog will be quarantined. Then we would observe further. But unfortunately, by the next morning, when we called the owner of the dog had died. And so we just swung into action immediately and got the dog brought in. And with the efforts of the DVS and the state epidemiologist, the sample was sent to NVRI in Jos for confirmatory diagnosis. That case came back positive. And the second case was a field case. And it came to us because we had a pet parent. This is a puppy that had been sold to a friend by the original owner. And she called me and said, oh, one of the puppies she had sold was acting funny in the house. And she suspects that it might be rabid. So we just spoke a little bit, and then we got the contact of the current owners of the house and spoke with them. So it was also an 8-month-old puppy, the Lhasa Apso male and intact. The dog was reported to be very aggressive, chewing objects, biting everything in sight, and of course had beaten 3 members of the same household. That was the day before. So we got those reports on the following day, and then we advised that immediately they go for post-exposure prophylaxis while the dog was quarantined in the State Veterinary Hospital and Diagnostic Center. Now, this dog died, samples were sent, and of course, it was confirmed to be rabies. So in the whole of these actions, right, practically we didn't have any challenges in detecting the clinical case or detecting rabies as it was, because we had a lot of knowledge on the part of the clinician, of course, on the part of the original dog parents who suspected, what information. And of course, she promptly called. The responses to these reports were very swift. On both occasions where there was a suspicion of rabies, immediate action was taken and the samples were collected. And of course, both dogs had been unvaccinated. The history of both dogs reported that they were both unvaccinated. Well, in our opinion, the community perception is very, very poor. And sometimes they can lackadaisical attitudes towards threats to life, especially when it comes to zoonotic diseases. So people don't respond so quickly. Although in this case, luckily, in the first case, the reaction from the owners were very poor because one dog had died the week before, and they waited until the second one came down before they came forward. But in the second case, there was prompt action. So, in our opinion, reporting in the first case was very lukewarm, but in the second case, it was proactive because they were worried and they suspected first, and they had the right frame of mind to contact the right people, the professionals, so to say, to get a positive confirmation. In both cases, luckily, we had prompt access to post-exposure prophylaxis vaccines, but unfortunately, the immunoglobulin, the rabies immunoglobulin was not accessible on day 0 for both cases of dog bites. So they were not able to use the immunoglobulin for both of those cases. However, I can report that we had very, very good synergy with the Director of Veterinary Services. We had very good response from the state epidemiologist at the Ministry of Agriculture. And well, we looked at to improve, in our opinion, of course, the best way for us to be able to improve control is to sustain mass vaccinations. We've tried in the past to do mass vaccinations. We did them 1, 2, 3 years. Of course, I don't think it was extensive enough, so we did not cover so much that we needed to do. Both dogs, like I said, they were not vaccinated. In one instance, in the first case, the owner of the dog actually wanted to vaccinate, but was sending the son. And when the son was supposed to come for the follow-up vaccinations and then the anti-rabies vaccinations, he decided to spend the money. So he was given money, he ate the money, and then forged the clinical signature on the card. Now, in the second case, there is the perception that they were not informed properly, they were not properly educated, and so they did not know what to do in terms of vaccinating. Well, this may be correct, but also this may not be completely correct. But in a nutshell, this is what transpired between February and between March up until now. Luckily, we've not had any other reports of any outbreak, but we're not resting on our oars. Hopefully, we would not get any report, because it's really a very harrowing experience, not something anybody should experience.
Thank you very
That's
much.
my brief on what's going on.
Thank you so much,
Thank you.
Dr. Bolaji Ajayi, for your own side of the report concerning the outbreaks in Rivers State. And thank you so much once again, the DVS. So you see the importance of having the two of them here, both the MVMA chairman of the state and the DVS. So I see already two questions on the chat box. I will just read it out, and then I think the first one goes to the DVS, Rivers State, Dr. Godswill. It reads, in the case of suspected rabies, is there a need to muzzle the dog, as in the case that the first presenter mentioned? Sir, Dr. Godswill, sir, are you with us? If he's not with us because of time constraints, can I have Dr. Bolaji respond to that question?
Yeah, sure. So the first case was a case of dumb rabies. So when the dog is presented to you, unless you have seen such a case before, you might never ever think that it was a case of rabies. So you treat it like a regular case, and of course, safety first. You would have to muzzle the dog. You would want to do that. Of course, the dog allowed itself to be muzzled. Now, however, in the second case, it was an aggressive form of rabies, and so it was quite obvious that this could be rabies. And usually, every precautions would have been taken to ensure that nobody else gets bitten. So yes, you may, without knowing that you're dealing with rabies, you may be able to muzzle a dog that has a mild form of rabies, a dumb form of rabies, because you're not suspecting rabies initially. But in the case where it is classic, it is aggressive, you definitely would not be able to muzzle a dog. But whether dumb or rabies, I think going forward, if the clinician knows, even if it's a dumb form, that this might be rabies, definitely an attempt will not be made to muzzle the dog. So.
Thank you very much, Dr. Bolaji. We'll come back to more questions later, but I think we'll just go right ahead to the next presenter. So I'll share his bio, and then after that, we will listen to him. Thank you very much. So I present the bio for Dr. Sabwa.
Dr. Sabwa Mukhtar is the founder of Prime Care Consults Limited, a leading animal health and public health consultancy in NAS and FCT. He earned a DVM degree in 2008 and holds an MSc in Veterinary Preventive Medicine and MSc in Public Health from Global Health and Infectious Disease Institute. A member of the Nigerian Institute of Management, and has built a strong career at the intersection of animal health systems, disease prevention, and community-based public health interventions.
Sabua is passionate about strengthening One Health approaches and advancing animal health and livestock productivity across Nigeria and Africa.
Thank you. Dr. Sabua, are you with us? Dr. Mukhtar, are you?
Yeah, thank you, Prof. Yeah, thank you, Prof.
Okay, so you have 5 to 7 minutes to tell us about KEFI, what has been happening in Nasarawa State. Thank you.
Thank you so much. Good evening, everyone. Thank you for having me in joining this very important conversation about rabies, a very important public health disease that every one of us know how to prevent it, which of course we know it's 100% preventable. Unfortunately, it keep on killing innocent human lives in our respective communities, as well as destroying dogs population across Nigeria and other African continents. I'll be having a different view. I will not bother the audience about the details of some of those cases that we have encountered. However, in the last 6 months, we have had 11 suspected cases that was presented to us in my own practice, and 5 out of the 11 turned out to be positive. We were only able to send 8 samples out of the 11 samples. Out of the 11 suspected cases. Unfortunately, 5 out of 8 turned out to be positive. Now, for me, I generally put together my field experience and the realities about outbreak of rabies. It's first, we have to be very passionate and emotional about rabies. One of the most recent outbreaks that happened in February, where 3 children were involved, and the highest, we have 3 age category. One was 3 years old. The second one happens to be 5 years old, and then the third child is 6 years old. My son Mohammed is actually 5 years old, and happens to have the same birthday month with James, who is a victim of dog bite. And the first thing that came to me is I thought of Mohammed because they are of the same age category, and I felt, what if this is Mohammed? So we have to approach rabies with emotions, as well as to take it as a personal effort in eradicating rabies. Now, put together based on the experience that we had in the last 6 months, we're able to understand that most of these cases that have been presented to us are cases that already have an advanced stage of symptoms. Unfortunately, once a case is being presented to you with symptoms, there is nothing much you can do about it. And that is why most of the cases we had, over 80%, have turned out to be positive. Now, we have also observed from the field that there is massive low vaccination coverage. Out of all the cases that we've handled, none of those dogs have been vaccinated throughout their life. And we've had a case where the dog is said to be about 7 years of age. That dog have never been vaccinated. That have underscored how a very low vaccination coverage about dogs. And most importantly, again, we also observe that there is lack of or absence of vaccination apathy when it comes to issue of rabies. Most of the times, community rely on goodwill, either from government, NGO, or private vets for free anti-rabies vaccinations. And that is drastically affecting the fight against rabies. In fact, rarely will you see a hunter or a local dog owner that will take his dog to private clinic for vaccination. Is always waiting for goodwill from NGOs or government or private veterinarians, or waiting for World Rabies Day to come before he gets his dog vaccinated. Now, one of the cases that we also observe that there is intra-community dog movement. When you have a case of from this community and then moving the same dog to another community. The last case we handled in February happens to we are able to trace back to a particular community where the beach is said to have died of suspected case of rabies, and then the puppy from the beach is being moved to the next community, and then unfortunately it happens to be positive of rabies. So apart from that, we're also able to encounter challenges. Some of these challenges include lack of coordination from among, especially the One Health response approach between veterinarians, human health, and environmental specialists or professionals. We have continued of race doctors, as well as the Department of Public Health from Federal Medical Center, as well as from a specialist hospital. In the last 5 years, we've not had any one of them participating in the surveillance or campaign against rabies during World Rabies Day, and we keep on inviting them. That have shown a very low or absence of coordination in the fight against rabies. Now, there is also limited availability of anti-rabies vaccine, which of course always result in stockouts, especially during outbreak or during campaign. In 2023, when we are having our World Rabies Day sensitization campaign, in fact, we have to individually find a way of moving out of the crowd, because all the vaccines that are within the particular local government have been exhausted. There was complete stock. There was stock out of vaccines, and then we're left with dogs that for us to vaccinate. Unfortunately, we don't have the vaccines that can be able to cover such kind of dog population. We also observe in the field poor community cooperation and then engagement, where you have sometimes owners are hiding the dogs or denying exposure or fail to cooperate with authorities. The case I had from Anambra State recently, where I was called upon in Abuja just last week, when we're trying to trace back with the owner of the dog, he make attempt to deny the fact that it was his dog that.
Hello, Dr. Sabua. It seems as if he's having some network problems. Dr. Sabua? All right. So, I think we'll just move on. Dr. Sabua? Okay, so we'll come back to talk some more on Kefi and the outbreak there. If Dr. Sabua, are you there? Okay, so in the absence of having Sabua continue for now, I would call on our researcher, Mr. Daniel.
Yeah, hello.
Okay, Dr. Sabua, you're back.
Yes, I'm
Okay,
back.
can you just round up quickly so that we can get to, if there are questions on for now, you respond to one or two, because we're going to come back again to have a full panel discussion on the questions that will be put forward. Thank you very much, sir.
Okay, thank you, Prof. Now, conclusively, there is some of the lessons that we've learned is outbreak will reduced when there is veterinary and human health collaboration. One health approach. It's one of the pillars that will assist in the fight against rabies. Community sensitization, which works better because that will increase the understanding of the community about rabies, and of course will increase cooperation, prompt reporting of cases of dog bites to clinics or hospitals. Again, very importantly, mass dog vaccination, not just mass, continuous dog vaccination will assist in ensuring the elimination of rabies. Finally, partnership, which of course we've seen recently. There has been partnership here in Nasarawa State with War Against Rabies Foundation, Federal Ministry of Agriculture, the State Veterinary Division. A lot of NGOs come to play, and that have assist in drastically curtailing the outbreak, as well as ensuring that the victims have been taken care of. So thank you so much for now.
Thank you very much, Dr. Mukhtar Sabua. Is there any pressing question on the chat, or does somebody have a very pressing question before we move on? Because we're coming back to questions and answers again afterwards. I don't think I saw any. In the absence of that, I will just move on to the next one. I want us to maximize the time so we can have sufficient time for question and answers. Thank you very much.
Sorry, Prof, I have a question.
Oh, great.
Yeah, was typing my question
Okay,
when you, so I just stopped typing, and by the time I unmuted, you are ready. Yes,
okay.
ma'am.
Yes, sir.
Nice to meet you again, ma'am.
Thank you very much, Coach. Thank you so much.
And good evening to. Hey? Yeah, weather is cool, and we have a very good, better weather now. Network rather. Yeah, my question is to the facilitators. I just want to find out in the we've been made to understand that case is already an outbreak, and we have reported cases. The two facilitators both reported cases where investigations were done, and it was confirmed that they were dealing with rabies. So my question is, considering the fact that rabies is zoonoses and a serious this, why are we not treating it as a national emergency? Why is it being treated just like a regional, or maybe something that, because the two cases, apart, if this forum was not there, I've not heard this on a national scene, on the news or something to say that, okay, this is what we're dealing with in a social area. As a vet also that is practicing, we've not heard about this except on this. And this forum is we have very, very few people on this. That's number one.
Thank you very much. You have a number two?
I have a second question. The second one is not a question. It's actually, it's not a question per se. It's just to say that in my locality here, we are very, very far away from reaching, all the facilities for either test or from or test or getting laboratory equipment that will facilitate or even give you positive results. And then for those who have been there, from the last time we had the chip talk up to now, we've had people who have been exposed to dog bites, who have actually gone on human anti-rabies. But we are not equipped. We really did not get to get those dogs to move them or get the parts that we can sell, because we're actually in a very, very remote area. So people like us, what can be done to facilitate such so that we can be able to test and get all of those things? Thank you.
Okay, thank you very much, Dr. Godwin. Because of time, you haven't gotten the rapid diagnostic test kits that I sent. Okay, so
no, ma, I'm not aware you sent anything yet.
You should have maybe remind them or asked, because I had given since February I had sent the rapid diagnostic test kit. So it's good that you are bringing it up now. Maybe the person I gave it to is very
my
busy.
God.
The person has been very busy, that I know, but I didn't know that you haven't gotten it yet. So maybe there's a miscommunication somewhere. I'm very sorry.
No, I haven't actually. If I had gotten that, I would have gotten to you, ma'am.
Yeah,
exactly.
and the rapid diagnostic test kit is just a screening test, but the DFAT. So so we need there's communication gap. That's what it means. So we need to talk about that so that we can also see how the samples can also be sent to the NVRI, even after doing the rapid diagnostic test, because that one is just a field screening test to help you know how to start right then before you get the final confirmatory from the laboratory. So we'll have to talk about how to get that achieved. Like you said, your distance is very, very far. And actually, that was why I also added an RNA shield together with the rapid diagnostic test kit, knowing that your area is very far. So we'll talk about that. Thank you very much for bringing that up. The first question, you were referring to how that information is not passed across nationwide on outbreaks. So anyway, Sabwa Mukhtar, that question is directed to you. I'll allow you to answer that before we get to the next person, the next speaker for the day. Thank you.
Yeah, hello. Sorry. What's the question again, Prof?
I was wondering how that all these outbreaks have been taking place and it's not been made known to the public. What do you have to say about that?
Yeah, I think there is proper channel of communication and transmitting cases of or confirmed cases of rabies. As a private vet, we use social media to relate to the public what we've been doing, plus also ensuring that the state veterinary division is informed, as well as, in fact, the last two that happened this year, I personally had to go and meet the Chief Veterinary Officer of Nigeria to inform him of the case, which, of course, he has also received the same the result from NVRI VOM, and that he have contributed with 100 doses of anti-ARV for ring vaccination within the community. So it's I think even the Federal Ministry of Livestock Development is aware of some of these outbreaks that happened, plus the fact that the state is also fully informed and aware of most of the cases that I've mentioned.
Thank you very much, Dr. Sabwa.
Now, the suspected the one of last week.
We'll just stop
community in Oka North.
Okay. Sorry, we'll just stop at this point. Then we'll come back again to hear some more, if you don't mind, sir.
Daniel Takumatize is Mr. Daniel Takumatize is a biotechnology researcher with a strong focus on One Health, zoonotic disease epidemiology, and antimicrobial resistance, AMR, in resource-limited Nigerian settings. His MSc research at Ahmadu Bello University, Zaria, conducted the first reported molecular and serological survey of dengue virus infection in Adamawa State, Nigeria. His recent work centered on rabies elimination science. As principal investigator for 2 War Against Rabies Foundation, WARF funded studies, he has systematically characterized critical barriers to rabies control in Adamawa State. Complementing the rabies work, he has conducted pioneering research on AMR drivers, including the first documentation of unregulated antibiotic dispensing and household antibiotic storage practices in Adamawa State.
Thank you very much, Mr. Daniel Takuma-Tize, for joining us tonight for this Chip Talk Africa. Please, you can go ahead and share your key findings from your study on the surveillance and post-exposure prophylaxis barriers in Adamawa State. Thank you. Thank you very much for joining us, Mr. Daniel.
Thank you, Prof. Today, I will briefly present key findings from our study on rabies surveillance and post-exposure prophylaxis access in Adamawa State, focusing on what we describe as the last mile gap in rabies elimination. We conducted a mixed method study across 3 local government areas, Yola North, Yola South, and Gire, involving 400 households. The goal was to understand not just awareness, but actual practices, system barriers, and economic implications affecting rabies control. We observed a strong knowledge, attitude, and practices paradox. While awareness is very high in this area, with about 82%, 83.5%, correct first aid and PEP completion are very low, with 32.1% correct first aid application and 28.7% PEP completion. More concerning is the fact that only 8% of bite victims completed full PEP. This shows a major breakdown between knowledge and action. The most critical failure is the absence of integrated bite case management. There is no reporting linkage between hospitals and veterinary services, leading to missed outbreak detection and ongoing transmission. The study also uncovered why PEP fails in this part of the world. PEP is a failure driven by multiple interactive barriers. Cost remained a major issue alongside stockouts and distance to access facilities. In addition, cultural practices such as consulting traditional healers delay effective treatment. In the study we just conducted, about 41.6 participants consulted traditional healers first while seeking for treatment. Now, our regression analysis presents some risk factors associated, and some of these risk factors shows that socioeconomic factors are strong predicators, such as low income, low education, rural residents are strong predicators of PEP non-completion. This reinforces the fact that rabies disproportionately affect vulnerable populations. The economic gap the study uncovered. At the moment, economically speaking, the system is inefficient. Treating humans' exposure is far more expensive than preventing transmission through dog vaccinations. This creates a strong case for reallocating resources, because as it stands now, the cost ratio of treatment is about 30, is in the ratio of 30:1. The last mile gap uncovered in the study, the problem is fundamentally about coordination failure. The science actually exists, but systems are fragmented and not working together effectively. Now, the solution is coordinated One Health approach. And this includes scaling dog vaccination, improving access to PEP, implementing digital reporting systems, and strengthening infrastructure and community engagement. Now, as a conclusion, rabies elimination remains a possibility. It's achievable and it's cost-effective, but only if One Health is implemented in practice, not just in policy. Thank you.
Thank you very much, Mr. Takuma, for that presentation on your findings. I don't know if anybody has any question yet that you want to ask Dr. Takuma. Mr. Takuma, yeah, the Dr. Takuma in advance, amen. All right, so do we have a question for Mr. Takuma for that? Very wonderful researcher. It's a privilege to have him on this dialogue. So while you're thinking of your questions, I know you have questions, so please, so we maximize time. Okay, I see a question. Is it possible for a state, probably those communities that have epidemic cases of rabies, to have prophylaxis drugs for those that are exposed to suspected dog bites? However, many people in the community don't know the clinical sign of suspected dogs. Most a time in the hospital, when we receive case of dog bites, we tell the victims that dog bite is a police case, but sometimes dog bite victim, they don't take it serious. So is it possible for a state, probably those communities that have epidemic cases, to have post-exposure prophylactics? Mr. Daniel, do you think you can attempt that question, or do we leave it for Madam Dorcas?
I think it's possible because from our recent findings, we emerged to understand that one of the risk factors across, especially this part of the world, is low education. And people are not aware of the fact that once you're bitten by an infected dog, the right thing to do, as common as treating, washing the wound with soap, as common as this first aid is, most people are not even aware of this. So it's possible to have PEP in a community and people are still coming down with this infection. It is very possible.
Thank you very much. So like I said, we're going to actually come back to discuss. And so we're just trying to maximize the time so that we'll have enough time for discussion. So before then, I would ask that we listen to Madam Dorcas, and then Nurse Dorcas will come up after the bio and then speak to us.
Dorcas Murney is the Assistant Director, Program Manager for Rabies at the Federal Ministry of Health and Social Welfare, Headquarters, Abuja. She holds a BNSC, RN, ERM, and is currently pursuing an MSc in Public Health. Dorcas is passionate about achieving organizational goals through teamwork, with a strong commitment to saving lives from rabies. She advocates for the provision of human rabies vaccines free of charge in Nigeria and works tirelessly to engage stakeholders in rabies prevention and control. She appeals to NGOs, philanthropists, civil society organizations, and individuals to support rabies-related activities, whether through financial contributions, technical support, vaccine provision, or awareness campaigns, toward the ultimate goal of eliminating rabies in Nigeria.
All right. So, Madam Dorcas, I hope you're still with us. Thank you very much, guys. Thank you very much, guys. Madam Dorcas, are you with us? I should say Nurse Dorcas. Many. Ma, are you with us?
Yes, I'm
okay.
Yeah.
Thank you very much, Ma. Please.
Yes, I am. Yes.
Yes, Ma. Go ahead, Ma.
Okay. Good evening, everybody.
Good evening.
I'm delighted to be part of. I'm delighted to be part of this winning team. Yeah. There are some issues here. The first one I'm supposed to speak to why the current situation of PEP availability in country. Yes, right now as I'm speaking, the PEP that the federal government procures, it is usually free of charge because the government is committed to ensuring that people do not die of vaccines now. There is no vaccine in stock. This does not in private clinics, in pharmacies, but the cost is the problem. The people who are normally bitten do not have the resources to purchase these vaccines for themselves. So this is the situation in the country. Yes, there are vaccines, but not free of charge. If you are bitten, you have to pay for it. The next or bottlenecks of this vaccine distribution in country. There are several challenges.
Okay, so Nurse Dorcas is having some internet challenge while talking about the vaccine challenges. So we will get back.
Can you hear me?
Okay, now
Hello?
we can hear you. We lost you.
Hello, can you people hear me?
We can hear you now, ma.
Yes, I hear you now.
Yes.
Go ahead, ma. So it's back to poor network. So I believe she's trying to say that when the government is able to fund post-exposure prophylaxis. Okay, so maybe somebody can mute Madam Dorcas for now until maybe her network is better. So I believe she was trying to tell us that when the Federal Ministry of Health is able to give make allocation for PEP, for post-exposure prophylaxis vaccine, then she is able to distribute to the various states. We have been beneficiaries of the vaccines from the Ministry of Health, Federal Ministry of Health. I remember I had a research way back in 2023, and we needed vaccines to be able to encourage people to report cases because people get beaten and they do not report. They don't come to the clinic because they don't see solutions in the clinic. And so we needed to have vaccines to attract them to come and report. So it's very important. And Madam Dorcas was able to acquire some vaccines under the Ministry of Health, and she gave me 50 doses of vaccines that really helped. She also sent to some states that needed it. So it was based on how, if you are frequent in reporting, in sending data to them, because without data, there's no way she can be able to know for sure that you have issues with rabies in your state. So we have to share data with the Ministry of Health, with Madam Dorcas's office, so that they can be able to know, so that when they have funding for vaccines and they're able to acquire vaccines, they'll be able to send to your state. I think that's what she was trying to cover to say within that time. I see so many wonderful people on the call. It's unfortunate I won't be able to make to call the individual people's names, but honestly, senior colleagues, and I'm just so impressed by the caliber of people that we have today. So we're going to just go right ahead and call back our field veterinarians, the DVS, River State, the chairman, MVMA, River State, that's who is also the CEO of MEX Veterinary Clinics Services, and then Dr. Sabwa Mukhtar of Prime Care and the national and the chairman of MVME for Nasarawa State to come back, and we will. Okay, somebody is asking a question. However, the question is to Dr. Tize, to Mr. Tize. So he's not a doctor; he has a master's, but he's a sound researcher and he's a biotechnologist. The question goes: can Mr. Tize help us with his comprehensive questionnaire template to survey or in other states? Thank you. Yes. Mr. Daniel Tize,
Yes, Prof.
What do you say to that? They're asking for your questionnaire. Would that be okay?
If you don't have problem with that, that would be okay, Prof.
Okay. So actually, Godwin is even part of War Against Rabies Foundation. He is one of us, so it's not a problem. Even if he isn't, I mean, we're here to help to make anything that we can do to just help this rabies elimination to be a reality is what we are here for. So thank you very much, Mr. Daniel, for being willing to share the questionnaire. So how can we, I don't know if I'm missing another question, how can we get the post-exposure prophylaxis in Boko? So I don't know if Madam Dorcas is back, because I remember she will have something to say about Boko. Because I also remember, Madam Dorcas, are you back? Is your network okay now? Okay, so maybe I'll just go ahead because of time. I remember the same year that Madam Dorcas sent us vaccines in Zaria, she also sent Boko, and she also sent to Benue and other states. But like I said, nobody would throw vaccines on you except you report. So you need to collaborate. And one major thrust that we have as regards the rabies control, one major thing that we need to do, all of us, is collaboration. That's actually one of the reasons why I brought this DVS chairman of MVMA, Nasarawa and Kefi, so that they can, and I'm sure you must have noticed from their presentation, they painted the importance of collaboration. I remember the Kefi case. Just to say that before I call other questions, before I call them to answer some questions that might come up. I remember the Kefi case. It was a community informant that first called me. That's the last case that in Kefi that Dr. Sabwa was talking about. He called me because he is my classmate and he knows of our work in War Against Rabies Foundation. He saw some people fighting in the community he was living in as he was passing to work, and then he asked why they were fighting, and they told him, he was told that somebody's dog beat 3 children, and so that's why they are fighting, because they want the owner of the dog to fund, who is a woman, to fund to take the children to the hospital for vaccination, but she doesn't even have money. So how will she do that? So that was the cause of the fight. And so he told them, he comforted them and told them that, look, I know a foundation, War Against Rabies Foundation. I would tell the CEO and she will take care of your problem. You don't need to fight. And honestly, that was what brought peace at that moment. And he reached out, and I was able to immediately call. I got Dr. Sabuar's phone number from one Dr. Sarah, who had moved. She was in Kefi before, but now married, so she moved to Abuja. And so I called Dr. Sabuar because he is on ground. You see, he is on ground. So he went and he called his clinic people, and they went and investigated the case based on my information. I gave them the phone number of this informant, Dr. Mr. Hussein. He was my classmate in vet school, but left us halfway to go and study a different course. So the interplay is the community reporting, and then reaching to the people concerned. And that's the War Against Rabies Foundation, or it can be the Ministry of Health, it can be the ministry, just whoever that you know can take the situation with seriousness. And based on that, we contacted, we got somebody that was also very active, because I asked specifically, I said, I want somebody that is active, that will not go and sleep over the case. So I was given Sabua's number. I called him, and he was not even in Kefi, he was in Abuja, but he assigned his clinic people to go and investigate the case. And we kept communicating. We immediately formed a WhatsApp forum for rapid response, and brought in all the necessary actors. And that was where the Ministry of Health was represented, the CVON was added, so a lot goes into it, and the key is collaboration. At the end of the day, we even had a community awareness after we had already paid for the treatment of those kids. We went back, and oh my God, it was so wonderful. The joy with which I was received in that community, it was awesome. So collaboration is the key. Please, I don't know if there's any question for my veterinary field veterinarians, the veterinarians present, Dr. Godswill. If there isn't, I have questions. I have a list of questions. But please, if you have a question, can you just unmute and ask? I see. Thank you very much, Dr. Teki, for the comments that for the responses that you dropped for people on the chat box. Okay, I see a question here, I think. Okay, that's the one I answered. So, Dr. Iveren, thank you very much for the question. How can we get post-exposure prophylaxis in Boko? Please, if there is a case, just let us know, and we will. And if the person can afford the vaccines, please don't bother disturbing us to give support. The support is for people that cannot afford it, because we don't want anybody to die due to a preventable disease like rabies, a vaccine preventable disease. So you can always reach War Against Rabies Foundation if you need help. But remember, we also have, aside reaching War Against Rabies Foundation, we also have to communicate. Although if you reach us, we'll definitely communicate with the government, because I am part of the National Technical Working Group for Rabies in the country. And so whatever case that comes up, we try to post it on the NTD, the National Technical Working Group, or else in groups like the one that we formed for Kefi, which has incorporated Rivers State, and it seems as if it's going to be one that will incorporate many other states. So the key is to get the information out there. I know that War Against Rabies Foundation has been used to do like a weekly what do you call it, on Facebook. We give information on outbreaks of rabies on Facebook. But at a point, I started feeling like it was offending some people in the, some people, some officials in the government. And so I just reduced it a little. But then, I mean, we can go back to that so that we can have people informed. And that way we know that this disease, it's really there. It's really there, and we need to work, we need to collaborate to make sure this is over. In fact, there are some states that have reached out to me, and I told them, don't worry, I'm going to bring you up, because we want people to know that this thing, this rabies, the outbreaks are still happening, and people are working at the background. It's just that we don't talk. If I tell you, look, there was a case in Kogi State, we have to send Dr. Theo with money to go and help make sure that the woman gets vaccinated. Let's see what, I mean, find out what we can do to help the woman. Her leg was swollen already, etc. But, we were able to intervene, just like how it was in the Kefi. I didn't blow trumpet that we went to Kefi and we did anything with Dr. Sabua and the rest of them, but I think we should actually start talking about these things. So anyway, please, question. Any question that I've missed? Okay, so indeed, this meeting is very important. This is Yobe, Hassan Mahmouda from Yobe. I'm suggesting that next time we involve supporting partner organization to organize this meeting. Okay, we involve supporting partner, organize this meeting central where people will attend physically from different places where rabies cases epidemics are taking place. Community sensitization is very important to stop and prevent rabies cases. Though virtual equally is important, but the attention and network issue affect the session. Yes, sir. Thank you very much. So this question seems to be directed to me, I guess, or to War Against Rabies Foundation. So we're doing this cheap talk. Maybe I should allow somebody else to answer this. Why do we think that we're doing this as an organization, War Against Rabies Foundation? Please, somebody else can answer quickly. Anybody with an idea can answer so that I'm not the only person talking.
Yes, I can answer.
Thank you very much.
This is awareness program.
Mama Dorcas, thank you. Please go on, Mama.
This is all about awareness creation. A lot of people do not know about what we are talking about here. Most people do not know about rabies, how deadly it is, and that it is preventable, and that even simple washing with soap and water, all these people do not know. So we are creating awareness so that people will know what to do to prevent rabies, to survive, and not to die. It's awareness we are creating.
Thank you very much, ma'am.
Thank you.
Does anybody have any?
Sorry, Prof.
Thank you.
Sorry. In addition to awareness,
yes,
I think one of the things that is also missing is what I call BCC. BCC is behavior change communications, because we realize here that even though there's a level of awareness, but yet rabies still persist. So there's need for change in behavior pattern so that people don't take this things casually, or people don't take this in serious. People shouldn't be taking rabies as if you have option. But then people should realize that rabies is fatal and rabies is also 100% preventable. So people should change their behavior towards rabies, not just to awareness, because to have knowledge is one thing, and to put the knowledge you have into practice is another thing. And I think in subsequent campaigns against rabies, people should also I don't know how you do it, Prof, but we should find a way of encouraging people to change their behavior towards rabies. Thank you.
Thank you very much, Mr. Takuma.
Well, permit.
Yes.
Well, Prof, permit me to add.
Yes, sir.
Yes, permit me to add that one.
Yes, sir.
We need to be conscious of the fact that rabies is endemic in Nigeria. We need to also know the burden of this disease and that it is killing people. It could be anybody. It could be vets. It could be dog handlers. It could be anybody. because one case of rabies is already an outbreak. Permit me to also add that most dog owners actually expect their dogs to bite other people. It will surprise you to know that those who have dogs, when you even tell them about vaccinating against rabies, they tell you it is removing the teeth of the dog, and that no, they don't want to remove the teeth of the dog. In other words, they don't want to vaccinate the dog because they want the dog to bite people. That is the mentality people have. And you will be surprised to know that even when you're dealing with our colleagues in the medical profession, most times when people have dog bites, the first place where they report to is at a patent medicine shop or a pharmacy. And that we expect that from those patent medicine shops or the pharmacies, this report is escalated to the hospital, which is the tertiary facility. But most times it is not done. So you find somebody who is bitten by a dog, and then he goes there, they just give him tetanus toxoid, give him ampiclox, and that is it. In the case of the Port Harcourt incident that happened, and then the person was reported to University of Port Harcourt Teaching Hospital, that was exactly what happened. The person actually reported to a primary, at least let's say a primary health facility. He went to a pharmacist. They just gave tetanus toxoid. They just gave ampiclox, and the person went home and was relaxed, thinking that all was well. Only for a couple of months later, he started showing signs. That was when he now reported to Teme Hospital, and then from Teme Hospital, now took him to UPTA. So the truth about it is that the channel of communication, we expect people to go to a veterinary hospital when they, from a human, a patent medicine shop, they cannot escalate that information to the hospital, and then for the hospital to take necessary action. So you find that there is a lot we need to do. This conversation needs to be expanded. People need to know about this disease, and that this disease is a killer. It kills faster than HIV/AIDS. The case that happened in Rivers State was so that the person was admitted on the 19th of February, and by the 24th, the person had died. So it becomes a very serious issue. Even amongst us, the vets, I can tell you that so many vets don't really know what to do when some of these things happen. When a person is bitten by a dog, they don't even know what to do. You'll be surprised that even vets don't even have records of vaccinations they have done on the dogs. So we need to have record to know, is this dog vaccinated? Has it been given rabies? At the point, because one of the cases, we were asking the doctor, have you given rabies? He was not sure that he had given rabies to the dog, anti-rabies vaccine to the dog. So we need to know about all these ones. And then people need to be informed, because if, for instance, you stray into a compound and there is no sign, beware of dogs, that's also in fact, it's a cause for litigation, because the person can say he was bitten and then there was no sign to indicate that there was a dog in the compound. So we need to have this conversation expanded, and people need to know as much as possible about this disease. I want to appreciate the effort of the Federal Ministry of Livestock Development. At the time when it was Federal Ministry of Agriculture and Rural Development, we got vaccines from NVRI. And then we were able to launch the rabies vaccination campaign in 2021, 2022, 2023. Kudos to the Ministry of Federal Ministry of Agriculture. But I want to say that because there was not enough logistics to reach out to some of the rural areas, what we did was in the urban areas. So we need to have, like it is going on now, you have transboundary animal disease vaccination, and we are reaching out to the interiors. We should do the same for rabies, because rabies is a very serious zoonotic disease. Thank you very much.
Thank you very much, Dr. Godswill, for that wonderful, passionate input that you just made. So you can see that this forum is majorly for those in training, either vet school, medical school, microbiology, that are interested in knowing more about rabies, the control. I mean, what are we doing in the nation and way forward? And also people that are already in the field. From what we have discussed, we can see matters being raised that are very, very crucial to the control of rabies in Nigeria, because look, people have been working, we have been working, but it doesn't look like, I mean, some people, surprisingly, you might not have even heard of the work we have been doing. Why? Because the country is so large and the work is so enormous. So if you look at it, we'll be thinking, oh, we have reached over 100,000 people. But that's nothing compared to 200 plus million people in the country. So, and that's why it is said, we keep going. We start small, but we have a direction we are going. We don't give up. We keep going. We have been doing community and outreaches since 2017 as an organization. Of course, before then, I have been involved with so many organizations, so many groups that have also done a few outreaches here and there. Before we took it up as a War Against Rabies Foundation to make it national and be able to also reach other countries. Like here with us, we have some students from Cameroon that are, volunteers in the War Against Rabies Foundation, and they because they also have problems with rabies and zoonoses in their country, so they are being part of us so they can learn. So not just students, we have experts here, and so from the experts we get to hear, from colleagues we get to learn what is happening, so that we'll challenge ourselves. We'll challenge ourselves and learn from each other and see, okay, you have this, I don't have it. Can you help us so that we can move forward in our state? So it's a platform that we learn from each other. All of us, we are learning. So thank you very much for that input. I see somebody raised his hand. Can I don't know. I saw a hand be raised. Who was that?
Yes, it's
Okay,
me.
please
It's me,
proceed.
Ma. Dr. Godwin Mongon.
Okay, if you can make it snappy, Doc, so that we can get to hear other people. Thank you so much for wanting to
Yes,
share. I was actually coming to you. Thank you. Go ahead, sir.
yes. Thank you, ma'am. I just posted that I wanted to share a little experience. We're in March now. From January to this time, I have had 3 significant cases here on the Mambila Plateau. One of which the culprit that was bitten by the dog, by the dog, has been receiving human anti-rabies vaccines. The second one is a situation whereby I had to go to the police station to report to the police because to get to the police to make them understand that the dog that beats the person was vaccinated and the vaccination records was up to date, and the fact that we had to treat it between the vet and the medics and not the police being getting involved in the whole thing. Now, what I want to say here complements what the Dr. Godswill, UVS River State mentioned here. I think the assumption that people are aware of rabies and how it works, I think it's not right, because I think that there's serious ignorance about about rabies and how its pathophysiology even amidst some vets and particularly with the medics. Because the third situation that I want to mention here is a situation whereby somebody had the issue of dog bite. It was not reported to me, to my office as the area veterinary officer here, but it was taken to the patient was taken to the hospital, and then the person, in fact, I was made to understand it was a doctor that stitched the area of dog bite. From my university days, I've been made to understand that the issues, dog bite wounds are supposed to be treated as open wounds, but the person stitched that area. And, by the time they brought back to the office, which was about the person's leg was so swollen, edematous, and also the wound was so gangrenous and all that of this. So it was infectious already. And then the person was beginning to experience some certain feelings, so funny feelings, so that we had to write to the PMO to say that, look, this stitch it shouldn't have been stitched. They should treat that wound, and then, but it was too late already to say after a month or so. I don't know, it was too late to say post-exposure prophylaxis or any other thing should be given, and human anti-rabies vaccines should be given. In fact, I was so confused. I didn't know what to do at that time. I only wrote to say that they should treat that one. So this is just the experience I wanted to share, and to say that we shouldn't assume that the awareness about rabies, whether in the populace or amongst professionals, is adequate enough. And then lastly, I want to say that we need to really blow our trumpet, man. We really need. If there is a case anywhere, we should hear it on the news. We should hear it where let the CVON make, like we had outbreak of hemorrhagic septicemia here, and the 1,000 cows died, and it was a national thing. In fact, international news even carried it. I think rabies should go the same way. Thank you very much. This is just what I wanted to add.
Thank you very much, Dr. Godwin, for the wonderful contribution that you always make to our meetings. Thank you very much. And please, that's why we should keep sharing the diary. There's an outbreak. We get it across and we see how we can handle the situation. Take note, I don't want to leave this point. Take note so I don't forget that as long as there is no clinical signs of rabies that has commenced in the patient, in the dog bite victim, you can still go ahead and begin administration of the rabies, human rabies vaccine, as though the day the case came to you is the day zero. As long as clinical signs have not started manifesting, you still have an opportunity to administer, because you can never really tell the immune system of the person. Some people, it takes more than even a year before the clinical signs set in if they don't get vaccinated. So as long as clinical signs are not manifesting, we still have a window to be able to save that life. So as I'm talking to you, if the person is still alive, I'm praying he's alive or she's alive, you can still advocate that they go immediately and get vaccine against rabies. Okay, so let me somebody has his hand up. Matthew Saba.
Yes, ma. Thank you very much, ma. Good evening, everyone.
Evening.
I actually appreciate this forum that has given us this opportunity to look deep into this disease that has actually been a problem in Nigeria. And one of the things I think we've been able to identify from the field, even working as far back as in Rivers State, was that we as veterinarians, although we know a lot about this disease, but we've not done a lot of advocacy even to our clients, and hence it's the reason why some of the clients around have not taken a need to see the importance of vaccinating their dogs. So usually with an outbreak of rabies case, is usually there is an outbreak, we go out, we respond. Even under the Ready Say project, we went out, we responded. After the disease outbreak, what next is the most important questions we need to ask ourselves. Has either One Health respondents, or has veterinarians, or public health personalities. But the question is, what populations of dogs do we have in our community? What are states doing to know the population level of dogs or animals that can be affected by this condition? Because each time we hear states receive vaccines to carry out vaccine coverage and all of that, while that is good, the federal government, Federal Ministry of Livestock, then Federal Ministry of Agriculture, was doing a lot to supply states with this vaccine. But it was key to know the population of dogs in the state, so that when you carry out your vaccination coverage, you can confidently feel if you are achieving a good level of protection towards eradicating the disease locally. And so one of the things that I feel that has actually not really helped us as veterinarians is that we've actually not taken our time, even at state levels or local government levels, to adequately know the populations approximately of this pets that are prone to this condition. So if we're able to do that and we carry out vaccination coverage, some states will not be collecting vaccinations, dose of vaccination as much as 1,000 doses and all of that, and that would help. So next is our advocacy. Recently, one of the there was an outbreak of rabies in suspected outbreak of rabies in Abuja. I own a clinic, and so I was called on a Sunday to attend to it. Why I picked it was much of an interest to me was that it was a small child that was beaten this time around. And so when we responded to it, we found out that the law enforcement agency took it upon themselves. They had attended to the case initially and they've handled it as much as they could handle it. And they had discharged the case without getting necessary health institutions involved in this. So it also shows that there's actually poor advocacy or sensitization even among the law enforcement agency. Because as good as this case was to redirect the case to the right channel for proper attention, knowing the fact that there are lives that could be lost in the situations of this. So it boils back to the fact that we must identify the necessary bodies to actually speak to or advocate with. While Mr. Daniel was giving us a statistic figure, he made mention of about 41.6% persons running to the traditional medicine healers for intervention. So one of the things I was thinking of is these people, because we're Africans, and so we go a lot to African approach of treating a lot of disease conditions. They could be targets for advocacy, they could be targets for sensitizations, so that at the end of the day, if they themselves are well equipped, they know how best to rechannel these people back to the proper channel to seek proper medications or health interventions. I think that's all I have to contribute.
Thank you very much, Dr. Matthew Saba. I think we'll just have to stop at this point because I want to ask each of the presenters to just give us like a 30-second take home, each of them, because as relates to their presentation, 30 seconds take home. Then I'll just come up and round of this topic. Next month, in April, we're going to have some more discussion so that you get to know more that is on rabies outbreaks that are happening in the country. We're also going to, alongside the venereals that will be speaking, we're going to have an expert that will also relate to us again. So please, I am sorry that I'm not able to take everybody's questions and comments now, but please, if you can just be around so that maybe I'll go through the questions after this, and that's if there's any that we have missed that is very pertinent. We'll try and address them the next time we meet. Dr. Bolaji, please, can you give us one key take home that you want us to have in our brains while we go home tonight, while we go to bed tonight, concerning what you have presented? Thank you, sir.
Quickly, I think, well, let me say two things we need to do. One, we need to make a lot of noise. We need to put figures out there, data. We need to put information out. We're not doing enough of that. We're doing a lot of work, but we're quiet about it, so nobody takes us seriously. Now, secondly, in all the outbreaks that we've had so far, if you go back to most of these states, you might find out that some of the ministries of health have sent out public health advisories, but we've not seen any from the veterinary end. The CVON is aware of all these conditions. We've not heard any information, just like the doctor from Taraba, I believe, said, or Adamawa, that he has not heard, and there's all these cases. So we need to send out public health advices so people are aware, and things need to be done properly. We need to be more proactive so we can nip those things in the bud before we have a challenge on our hands. We have it already, but we can still fight it and make sure it's contained. Thank you.
Thank you very much, Dr. Bolaji. I see somebody dropped a comment. I think there should be a clear approach to handling a case of dog bite and also reporting rabies cases. Maybe you come next month, and we have a rapid response toolkit for rabies. It covers all that, and I think we have also been handling it here, but we'll touch a little bit on it again next month, April. Thank you very much, Dr. Bolaji. Can we have Dr. Sabwa on call? Is he around? Dr. Sabwa, are you around?
Yeah.
Yes, sir. A matchstick point. A quick one, sir. Hello, sir. Okay, so it's like the network is playing hanky-panky with Dr. Sabwa. Can we have Dr. Godswill, please?
Yeah.
Well, for me, it's just to say the reality of it is that we have rabies endemic in Nigeria. As long as we have stray dogs, we have hunter dogs, the Sylvatic Circle will continue to encourage the endemicity of this disease. Surprisingly, even the cases we had in Rivers State were not even from stray dogs. They were dogs, companion dogs kept with people that actually had this disease. So it becomes very important that we become conscious of the fact that rabies is endemic. We need to do more advocacy. We need to do more collaboration. We reached out as much as possible to even the DSS, and you'll be surprised that the DSS even has a code on how to control this disease. And then the last one is vaccine preventable. So we make as much vaccines available so that we can do mass dog vaccination once more, just like we did 2021, 2022, 2023, and then see how we can get logistics to reach out, because these dogs are in the rural and peri-urban areas, to reach out to these local areas and then carry out this vaccination. Thank you very much.
Thank you very much.
Hello, Prof.
Yes, Dr. Sabwa.
Yeah, thank you.
Thank you, Sheriff.
My final words. My final words on this. It's let us uphold 4 pillars in ensuring that we eliminate rabies in Nigeria, and one of the 5th pillar is sustained continuous vaccination, proper and prompt reporting, public awareness, as well as collaborative One Health action. Public awareness is key. My wife, being a legal practitioner, have mentioned to me that she's not quite aware of rabies until when she met me. So that means to tell us how poor.
Okay. So thank you very much, Dr. Sabwa, for that. We'll have to get onto our researcher, Mr. Daniel Tize. Daniel Tize, last word.
Yes, Prof.
Yes.
Yeah. My final say over this deliberation is rabies is 100% preventable, yet it persists because our systems are not aligned. So eliminating rabies is not a scientific challenge. It is a system challenge, and it is one we can solve because the illness is clear. So we must integrate surveillance, remove barriers to PEP, and invest in dogs vaccination. So if we must achieve a 0 by 2030 target, it's not actually a dream, it's a decision. And so I encourage all of us to key into this decision. Thank you.
Thank you very much, Mr. Daniel Takuma. Nurse Dorcas Mani. Nurse Dorcas
Yes.
Mani. Oh,
good evening, Prof.
Thank you very much, ma'am.
Yes.
Thank you for staying with us this time. Last word.
Yes. For us to defeat this preventable killer, silent killer disease called rabies, integration is the way to go. One Health has come to stay, and One Health is not an option. One Health, it is a necessity if we must survive. Thank you very much.
Thank you very much. I hope you guys are taking time to read what is on the chat box, because a lot of good information have been dropped by our colleagues on the chat box that we're not able to read. But you know, I'll have a record of it definitely because we're recording it. So thank you very much, our speakers for today, our discussants, Madam Dorcas Amenyi, Dr. Bolaji, Dr. Godswill, Dr. Sabwa, Dr. Mr. Daniel. Thank you so much for your contributions. Have I missed anybody? I think all of them have given us their last word. So let me just take this time and thank each and every one of you for being with us from the beginning. Honestly, I wish I could call names. I won't be able to finish calling all the names, but I really want to thank senior colleagues like Dr. Idris Kyota from Kano. He is the director, One Health, NCDC Kano State. He has been with us. He's an encouragement to War Against Rabies Foundation. We have been working together. I think this is Dr. Nuhu Ibrahim from, I've forgotten the name of the state now. Also a very great rabies activists, so many people. I can't go, Dr. Jerome, clinician in Zaria, Dr. Sharifat. Thank you so much, Ma. Your appearing in our meetings is so encouraging. It's been wonderful knowing you. Then this National Blood Service person, thank you very much. You have been consistent. We're very grateful. So Dr. Abubakar, Ladan, I mean, so many. So please pardon me that I'm not able to call everybody's name. You are all so important to the fight against rabies. Remember, this War Against Rabies Foundation just forms a platform for the One Health. I mean, if you are, it's a model disease, we all know. So if you are able to using the rabies, if you're able to establish that platform of One Health, then it's very easy to just have it as a rider for other zoonoses, and that's what we have been able to achieve in the War Against Rabies Foundation, because we have so many professionals, not just veterinarians, not just human medics. We have so many professionals in War Against Rabies Foundation, so that we can have the wealth of everybody's knowledge in the control of zoonosis generally. Thank you so much, Dr. Joshua. Professor Joshua is a medical doctor in War Against Rabies Foundation, etc. Thank you very much for always being with us. Everyone here, because I see a lot of people that have been attending. Not to talk about the War Against Rabies volunteers that are so faithfully attending this meeting all the time. Thank you so much for the people that have been helping to make this meeting possible. Thank you so much, my students in ABU Zaria that have been so sold out to the War Against Rabies Foundation. Thank you for my ex-students, my students, master students, PhD students that have been supportive in one way or the other. I am just so grateful. Special thanks, very, very special thanks for data support for our students attending this meeting by HAPPY. HAPPY, HAHPI, is Happy Animal, Happy People Initiative, and the Vet Medics. Vet Medics is a clinic in Zaria. It's also the CEO is part of War Against Rabies Foundation, and they were all my students. It's just an honor to have my students coming out, starting their own establishments, and they're making it. Happy, the CEO of Happy, is in the UK. He's working in the UK. The CEO of Vet Medics is in Saudi Arabia, I think, or Dubai, one of the two. And we also have Dr. Ariel. Dr. Ariel Tagui is working, is a staff of United Kingdom Health Security Agency. He has promised to fund the data support for our students in Cameroon. So we are so grateful, and many more are coming up, because my God, we have, so in Nigeria, we don't actually need to just hands off and only be looking for support from abroad. But nevertheless, I also want to really, really appreciate my collaborator, my research collaborator, Professor Katie Hampson, who has been supporting us with rapid diagnostic tests. As we have heard, some people are asking for it, and I'm going to let her know that we have run out of stock and we need more, because the rapid diagnostic tests, they are so expensive. Just one, as of 2022, one was $10, if I am not mistaken. But she gives us free. The last time we had somebody come from the UK, she was able to send the person with 200 piece tests of the rapid diagnostic tests. And I was able to share it to as many War Against Rabies collaborators that needed it as possible. So we are very grateful to Professor Katie Hampson of the University of Glasgow, United Kingdom, for the support. I hope Terese is here, so that he can, before I get to her, he can begin to intimate her that we need more rapid diagnostic test kit. You can't afford to miss the next meeting. The next meeting, we are going to have wonderful people. In fact, we are having our own chief of the Rabies Diagnostic Laboratory, MVRI, Dr. Teki Ishaya Sini. He has been with us, and we're going to hear him next month, in the month of April, during the Chip Talk Africa, by the grace of God. You can't afford to miss our Chip Talk Africa April edition. So please come and let's, put our heads together. And remember that for everywhere, every community that we do outreaches, we share information, we share flyers, we teach them about rabies, how to prevent it, how the signs. Our flyers all contain that. And just like in Kefi in February, when I went, this March, after we had done the intervention and provided vaccines for the 3 children, when we went, Dr. Sabwa organized community sensitization and advocacy visit to the chief, and it was a wonderful time. We taught them about rabies and everything that has to do with how to handle dogs, and shared flyers, in Hausa and English to them. So I will make a small video and share it. Please, this particular meetings are being put on our YouTube page. So by tomorrow, it should be ready for you to share to friends that need to hear what we have discussed here. And like many have said, we need to blow the trumpet. We need to not really blow the trumpet. We need to make known what is happening and what we're doing, so that people can learn from it, and that way we move forward more. So thank you so much. Thank you so much for being part of this. Believe me, we really appreciate. See you next month, in the month of April. In just a few hours from now, we will enter the month of April, and I wish everybody a wonderful April. Please remember, don't let anybody fool you because of April Fool. That happens. Thank you, Chief Teki. Thank you very much. So, guys, have a good night's sleep. Samsia, thank you for all the encouragement. Isaac Tonga, thank you so much for all the help. Tolua Nimi, Dr. Sarah, Becky, thank you for all the help. Dr. Emmanuel. The surname is always difficult for me to pronounce. Emmanuel O. Thank you so much for all the help. Thank you, Dr. Magbon, for all the help. Hayetu Moazu, do have a good night's rest. Nathaniel Bakura, thank you so much. Dr. Alawal Abdurazak, thank you. Thank you for attending. Thank you, Dr. Godwin. Dr. Istifanus Joshua, nice to have you. Do have a good night rest. King's Kennel, Good night. Thank you for attending. Daniel Isiaka, thank you so much for attending. Once again, Bilham, thank you for attending. Idoga, wow, Ada, thank you for attending. Bolaji, okay, that's our guest speaker. We're very grateful, sir. Please, family. Somebody is saying something. I will just keep thanking everybody until you guys leave. So just keep. It's just nice having all of you.
Thank you, ma. Thank you, ma.
Thank you. Thank you so much. Thank you so much.
Good night, ma.
Good night. Have a Victor Ahmed. Thank you so much for attending. Thank you. Ah, my
Thanks,
chief.
man.
Eze, Jane, thank you, Sarah. Goodness, George. You have been quiet on our WARF group. Oh, I need to hear from you. What are you doing? What are you doing in your community? You people. Kwaja, Elijah, good evening. Nice having you here, Elijah.
Good evening, ma. Thank you very much, ma.
Thank you,
Good
Dr.
to be here, ma.
Nuhu. Thank you so much for attending. I think you are with the Rivers, right, Dr. Nuhu? I'm mixing it. Good evening, Doctor. Good evening, Kwaja. Yeah, they.
Hello, ma. Good evening, ma.
Good evening, Kwaja.
Yeah, thank you, ma. Good evening, ma.
Thank you so much. Who is this Techno
Thank you, ma.
CK6?
Thank you very much, ma.
Thank you. I really appreciate Zelani. Who is Techno CK6? I don't see. Yvonne Oga, thank you. Joseph Alta, thank you. Techno CK6, who is that? Uh-oh. All right, thank you so much. Do have a good night rest.
Thank you for the wonderful presentation, man. Thank you for the wonderful presentation, man.
Thank you, Abdulrazak. Thank you. Thank you so much for the support. I really appreciate it. I'm here.
Okay, thank you, ma, for the presentation.
Thank you,
Good
Abdulrazak.
night.
Abdulaziz, now go there. Umar Sanuko.
Thank you.
Yeah.
No problem.
Thank you so much. Thank you.
No
Eze,
problem.
Jane, thank you for attending.
Thank you for the presentation.
Thank you so much for the encouragement. Thank you. Nathaniel Bakura, thank you. All right, guys. I think I've called everybody's name, ba?
Okay, thank you, ma. Good night.
Hagai Dika. Who is Umaru Emmanuel? That's a. Do I know this name? Kanawa.
Yes, ma. Thank you, ma.
Yes, I know Kanawa. Good evening. Dr. Emmanuel Nuche.
Thank you.
How far?
Yes, ma. Thank you.
Thank you. All right. Good night, everyone. Shitu Yahaya. Interesting. I didn't know you're here. Oh, wow. Thank you. Thank you. Emmanuel Onoja, thank you for all the help. Thank you so much. Onuche, thank you. All right. Okay, so I think I'm done with all the names. God bless us all. As we enter into April, we move forward. Bye-bye.